Hello everyone, I will tell you 7 simple steps to prevent coronavirus. If you like my video, please subscribe. 7 simple steps to protect yourself and others against COVID-19. Coronavirus disease, COVID-19, is an infectious disease caused by a new coronavirus. Most people with infection will experience severe symptoms and will not be cured. But others may experience serious illnesses, especially in the elderly and those with previous illnesses. Here are some simple steps you can take to protect the health of yourself and others. These tips can be followed by everyone, but they are very important if you live in a COVID-19 area. 1. Wash your hands often. Practice hand washing thoroughly with hand sanitizer with alcohol or washing with soap and water. Why? We always use our hands to handle things that may be contaminated. We may not even realize that we hold our face. The virus has been transmitted to the eyes, nose, and mouth, and we are infected. Viruses die that may be in your infected hands, including the new coronavirus, by hand washing, using soap and water, or using hand sanitizer with alcohol. 2. Avoid touching your eyes, nose, and mouth. We often hold our hand unknowingly. Be careful about it, and avoid touching your eyes, nose, and mouth. Why? There are many hands holding and it can get viruses. Once the hand is contaminated, the virus is transferred to the eye, nose and mouth and may enter the body and cause pain. 3. Cover your cough and sneeze. Make sure you, and the people around you, and follow proper respiratory hygiene. This means covering the mouth and nose with the inside of the elbow or tissue when coughing or sneezing. Immediately dump the used tissue into the lid and wash your hands. Why? If a person coughs or sneezes, the small droplet from the nose and mouth can get infected. By covering your cough or infection, it is possible to prevent the spread of viruses and germs to others. By using the inside of the elbow or tissue, and not your hand, to cough or sneeze. Avoid moving the contaminated droplet with your hand. Consequently, the virus is prevented from transmitting to the person or object. 4. Avoid humane areas and close contact with people with fever or cough. Avoid crowded places, especially if you are 60 or older. Disorders such as high blood pressure, diabetes, heart and lung disease or cancer. Keep at least 1 meter distance from you and anyone with a fever or cough. Why? COVID-19 is primarily transmitted through a droplet that exits the mouth or nose when a person coughs or sneezes. By avoiding overcrowded places, you stay away yourself, at least 1 meter, from people who may have COVID-19 or anyone else with the disease. 5. Stay home if you are sick. Stay home if you have pain, even cold, and cough. Why? By staying indoors and not going to work or other places, it will heal you faster and prevent the spread of disease to other people. 6. If you have fever, cough, and difficulty breathing, consult right away, but call the health facility first. If you have fever, cough, and difficulty breathing, consult ahead of time. If possible, call the hospital first or health center to tell you where you are going. Why? This will help ensure that the advice you receive is correct. You will be directed to the right health facility, and you will avoid infecting others. 7. Get information from trusted authorities. Find out the latest information on COVID-19 from trusted artists. Make sure the information is from reliable speakers, the Department of Health, World Health Organization, WHO, or your local health worker. Everyone should be aware of the symptoms. Most times COVID-19 starts with fever and a dry cough. Why? Local and national authorities know about the latest information. If COVID-19 is spreading in your area, they know better what the right advice is. Should be given to your area, so that people can protect themselves. Thank you for listening. Please subscribe for new update.